Hi, I'm Steve Adubato. Welcome as we tape remotely on the 17th of November, joined once again by Dr. Shereef Elnahal, President and CEO, University Hospital. Good to see you, Doctor.
Thank you for having me on, Steve.
Our pleasure. We'll talk a little bit about not only where we are as we're doing this at the end of 2020, but moving into 2021. But let's talk about your role in the Biden-Harris transition team. Describe what you're doing and why it's so important.
Well, I'm glad you mentioned that, Steve, because it's a real honor to be on the team. I'm happy to be on the Veterans Affairs Agency Review Team, which is tasked with transitioning the work of the agency to whoever the agency leadership will be on day one, right after inauguration. We have to be prepared. The president-elect, vice president-elect have to be prepared to lead on day one. I had the honor of working at the agency in the Obama administration. And was asked to do so. And one thing that's very heartening is that I believe our leadership role at University Hospital nationally in running this pandemic had a lot to do with the ask that came through and the fact that we're providing advice and counsel to one of the most important health systems in America with one of the most important missions in America to serve those who served us in uniform. So it's really an honor, and I look forward to providing my input and learning so much myself.
You know, I'm curious about this. When this show is seen in repeats after the 20th of January, when there will be a President Biden and a Vice President Harris, what do you believe from a public policy and public health perspective, Dr. Elnahal, a solid, strong, effective federal response to COVID should look like?
Well, the most important thing, Steve, is that you need to have the right messaging and example setting from the people leading the country. And you can already tell that the president-elect, vice president-elect are doing so, emphasizing the simple but very important things to curb the spread of COVID-19, the importance of mask wearing, the importance of limiting household gatherings, which is, we know from contact tracing data, one of the most important ways that it's spreading. And of course, social distancing and everything in between. That is the most important thing that national leadership can do, but also integrating and breaking down silos in government to make sure that the response is coordinated, that you're including everybody who may have input to be able to execute on behalf of the American people. I think that the president-elect is already doing that, and that's already starting, which is very heartening to see.
Well, let's try this. Again, this interview seen in 2021, several people we've had on said, you know, realistically with the vaccine, while there are a lot of questions that need to be resolved and getting it out to the general public, it'll be well into 2021 if, in fact, it's available to us. So talk to us about this thing, not just called pandemic fatigue, but what is real, pandemic fatigue. What advice would you have for people who are saying enough? I'll just wait for the vaccine.
Well, the first thing to mention, Steve, is that pandemic fatigue around this whole environment we're in is understandable. We shouldn't be castigating people or blaming people for being tired. I'm tired, everybody's tired. But the best thing we can do is to reinforce that the consequences of relaxing on these public health restrictions can be life-threatening and will be life-threatening. To say that we need to be careful this Thanksgiving, this Christmas, so that we can have many Thanksgivings and Christmases to come with our loved ones, wherever they may be, is the message that we need to put out. This is a life-threatening pandemic that is only getting worse. And we have to make sure that we're looking not just in the short term in terms of our comfort, in terms of our ability to see our loved ones, for example, but really in the long term to protect yourself and to protect your loved ones and community. This is not just a mission to make yourself safe. This is a mission to make the most important people to you also safe. And I can't emphasize that enough. We cannot relax the restrictions. There are ways to stay connected, thankfully, in the 21st century. And
obviously,
that's
what we're doing right now.
Yeah, exactly.
Yeah, we'd rather be in the studio, but we will take this. Is that a good way to say it?
Absolutely. And, you know, we have to accept something slightly less than we normally are able to see with in-person interaction. But to do that temporarily and to wait for the vaccine to get to the general population is an absolute imperative.
So, you know, you've talked about a new vision for University Hospital. One of the hospital systems that supports our healthcare programming. What is the new vision and why does it matter to the people you serve every day, particularly in urban communities like Newark, New Jersey?
It's really important to us, Steve, and I'll describe why. We were actually going to release this vision right before the pandemic started. And one question I had as we were going through the worst of this was that, is this vision still relevant, given the new world that we're living in and given the new normal that we're likely to enter? And as we looked at the elements of the vision, we realized that not only is it still important, it's even more important in light of the national reckoning with racial and social justice, in light of the fact that the pandemic has exposed the cracks in care for urban majority minority communities. The vision itself is on three foundations. The first is that we have to reinvest doubly in improving quality and patient safety, setting reasonable expectations, given all the publicity around the hospital with quality issues. We're still committed to that, but also setting realistic timelines. The second is improving the financial condition of the hospital, not to stack up our bank account, but rather to be able to reinvest in growth for services for healthcare needs that will only grow in light of the pandemic. And the third is to double down and recommit to our community in every way in light of the Newark Accords, making the Newark agreements, which was the agreement that finally made peace in Newark and the other reckoning.
Post-rebellion in 1967, that is what University Hospital came out of, correct?
Exactly, and University Hospital was rededicated to the community to end that violence. Now we're in another national reckoning with racial tension, including in the city of Newark, and we have to be there and redouble our commitment to that agreement.
Real quick, they're going to put a graphic up, our team confronting racism, an ongoing series I've talked to you about, we've been doing for a while. Disproportionately, Black and brown Americans affected by COVID getting worse, better, what? Because everyone seems to be, not everyone, we should be more aware of that. Is it making a difference? That awareness.
It's making a difference, and we need to keep harping on that fact. The fact that COVID-19 continues to devastate people of color, Black and brown residents in every part of the country, including in the city of Newark. You're seeing it now. The highest positivity rates in New Jersey reported are in the city of Newark, a majority minority community. And it's interesting, Steve, that as we've gotten more information as a country about how disproportionately this has affected communities of color, ideas like letting herd immunity just naturally take effect, letting people get infected, have started to enter the Overton window of the discussion about what to do, which is ridiculous. Sacrificing the lives and well-being of vulnerable communities, including people of color, is part of the fabric of systemic racism, and we cannot continue that. We have to rather get all the resources we need into cities like Newark, to places like University Hospital, to be able to stem this and prevent spread as much as possible, because the very people, the essential workers that are on the front lines, are disproportionately people of color making this country go. We owe them better.
Dr. Shereef Elnahal, we'll follow this conversation, keep talking to you, and also acknowledge again that you're one of the leaders on the Biden-Harris transition team. We'll talk to you in 2021. Shereef, thank you so much for joining us, my friend.
Thank you, Steve. Take care.
We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Robert Wood Johnson Foundation, the North Ward Center, PSE&G, Suez North America, ADP, Valley Bank, the Adler Aphasia Center, NJ Best, and by the Fidelco Group. Promotional support provided by NJ On Air and by CIANJ and Commerce Magazine.
The North Ward Center was founded on the vision that community is connected to neighborhood stabilization, and neighborhoods need a place for kids to play. That's why we're building a recreational complex in the heart of Newark. Unfortunately, inner-city youth development programs are dwindling. We want to expand on our promise and build a place where kids are welcomed and doors remain open. The North Ward Center, building a better community, 48 years and counting.